And we're live on Facebook as well now.
Okay, great. Thank you. My name is Sani Aliyu. Good afternoon. We're here to talk about issues to do with allergy as with regards to the COVID vaccination. I'm very grateful we have Dr. Shaib Nasser, consultant in allergy today, who will be taking us through the key concerns that staff might have with regards to allergic issues with the COVID vaccine. Shaib, you have about 15 to 20 minutes, I believe, after which we'll take any questions that might come up. Over to you, Shaib.
Thank you very much, Sani. Now I'm going to just go through a few slides, and I've collected a series of questions which we've been asked by both patients, by GPs, by hospital consultants about people's potential allergic reactions to COVID vaccines, and also some reactions that they might have developed as a result of the COVID vaccination. So let's go through some of these questions. So the first question that was often asked, actually more so right at the start of the vaccination campaign rather than now, but I think it is still relevant. And the question is, I'm anxious about vaccination, perhaps because you've had previous problems with vaccinations. Can I have antihistamines beforehand? The answer to this is that if your symptoms could be helped by taking an antihistamine, for example, if you had an itchy rash, then it's reasonable to take an antihistamine such as cetirizine, which you can buy over the counter, and you can take 1 or 2 tablets an hour before vaccination. But if it's a headache or a little bit of numbness or feeling a little bit dizzy, antihistamines may not help. But generally speaking, we have advised taking antihistamines beforehand. Cetirizine is a good one. It's very potent. You can take 1 or 2 tablets 1 hour before the vaccination, and it's very effective at stopping some of these mild allergic reactions. Second question is, I am worried about reacting to the vaccine. Can I be tested for allergy to the vaccine or for allergy to polyethylene glycol, which is an ingredient of the Moderna and Pfizer vaccines, or polysorbate 80, which is found in the AZ vaccine? The first thing to say is that allergy to these things, both polyethylene glycol and polysorbate 80, is incredibly rare. So over 20 years of seeing tens of thousands of patients, we've identified just 8 people with an allergy to polyethylene glycol. So there really is no indication for allergy testing to the vaccines or their ingredients unless you have a previous history suggestive of allergic reactions to these excipients, to these ingredients. And these ingredients cause very severe allergic reactions. And usually the history is that you have multiple anaphylaxis to unrelated drugs, all of which contain polyethylene glycol. And if that is the case, then you need to be investigated, but it would be extremely unusual to have that sort of history. So a related question is that I have multiple drug allergies. Which COVID vaccine can I have? So if you have a history of anaphylaxis within minutes of taking a drug to a variety of drugs, each of which contains polyethylene glycol, then you must avoid the Pfizer Moderna vaccines. Now, I should say, as I say, only 8 people I've come across fit into this category. However, if the reactions are non-immediate, in other words, they occur 1 to 2 to 5 or 12 hours after medication starting, or they're non-allergic reactions, so in other words, they're headaches, feeling a bit dizzy, even a mild rash, then this is not a contraindication to any of the COVID vaccines. But if you've got a history of a confirmed allergy to polyethylene glycol, then we now know that you can have the AstraZeneca vaccine safely administered. And we've given it to all 8 of our polyethylene glycol patients, polyethylene glycol allergic patients, absolutely safely with no symptoms at all. Another question is, I have a history of chronic urticaria or angioedema. Do I need to take any precautions? The important thing for me to say about this is that the urticaria and angioedema must be fully controlled, and you should remain on regular treatment to maintain control. In other words, regular antihistamines. If you are on a particular day, if you're experiencing lots of urticaria, you should not go and have your vaccination on that day, because the vaccine is likely to make it worse. But if the urticaria is in remission and you're not on antihistamines, you may wish to take a couple of cetirizine tablets 1 hour before vaccination and continue for 3 to 5 days afterwards, after vaccination. That's what we're advising, and it's been very effective so far. Another question that we get asked, because it's in the Green Book, because a lot of the patient charities have discussed this, is I have a history of idiopathic anaphylaxis. Now, this is rare. This is pretty uncommon, and idiopathic anaphylaxis means that you develop anaphylaxis without any obvious trigger. So it's a diagnosis of exclusion by an allergist. It means that you experience anaphylaxis, usually with a drop in blood pressure, without a trigger, without a food trigger, without a drug trigger. And if the diagnosis has been confirmed, then there is no contraindication to any of the COVID vaccines. But if the episodes of anaphylaxis have occurred within minutes of taking a drug containing polyethylene glycol, you do need further evaluation, but that's not idiopathic anaphylaxis. So idiopathic anaphylaxis that's been confirmed in an allergy clinic is not a contraindication to any of the COVID vaccines. And you can have your COVID vaccine, you can have any of the COVID vaccines without any concern, anxiety. But I would again suggest that you take a couple of cetirizine tablets 1 hour before vaccination. I developed severe swelling of my arm after the influenza vaccine. Which vaccine can I have? You can have any of the COVID vaccines. So allergy to vaccines, previous vaccines, is not a contraindication to any of the COVID vaccines. One thing that we should just mention is that the excipient, the ingredient in the messenger RNA vaccines, the Moderna and Pfizer vaccines, is polyethylene glycol. No previous vaccines contained polyethylene glycol. They're the first vaccines that have contained polyethylene glycol. So you can receive any of the COVID vaccines, and a local allergic reaction to any vaccine in the past, any injection, does not mean that you can't have any of the COVID vaccines. So that's a very easy one to answer. Again, if you are the sort of person who develops localized reactions to insect bites, injections, etc., then again, taking a couple of antihistamine tablets 1 hour before vaccination would be a good idea. So again, this is a similar question, reactions to previous vaccinations. And again, I would say you can have any of the current COVID vaccines. But again, I would recommend that you take an antihistamine, 1 to 2 tablets 1 hour before vaccination. If you have developed a rash for several days after vaccination in the past, then continue taking cetirizine 10 milligrams twice a day for 3 to 5 days after vaccination. I collapsed after my influenza vaccine and was taken to hospital. Can I be seen in the allergy clinic and have my first COVID vaccination in hospital? Well, again, this depends on the cause of the collapse. Lots of collapses that we are seeing are not allergic. Many of them are due to what we call vasovagal or fainting episodes. Certainly you can have further vaccinations, but just be aware that you might get similar symptoms with future vaccinations. And if there were no symptoms of allergy, so in other words, there was no rash, there was no swelling, the blood pressure recovered quickly without any treatment or just with minimal treatment, then you can have any of the COVID vaccines. We were going through a period where we were looking at influenza vaccines to see whether they contained polysorbate 80. We're now less interested in this because we're not convinced that the amount of polysorbate 80 in the AZ vaccine is sufficient to cause an allergic reaction. So we actually believe that even if you might have an allergy to polysorbate 80, we believe that you're actually quite likely to tolerate any of the vaccines. The other thing to note is that if you have a confirmed allergy to polysorbate 80, then the messenger RNA vaccines can be administered. But again, it's important to take a detailed history after a collapse after any previous vaccine and to look for allergic symptoms. So so if you've had a history of anaphylaxis after receiving any of these vaccines, the DTP, MMR, pneumococcus, hepatitis B, all of the vaccines that are listed on this slide do not contain polysorbate 80 or polyethylene glycol. So you can have any of the COVID vaccines, even if you developed anaphylaxis, which again is extremely uncommon after vaccination. The rate of anaphylaxis after general vaccinations is about 1 in a million. So it is very uncommon. So these are the vaccines that do contain polysorbate 80. Prevnar 13 and Repivax are the two that do contain polysorbate 80. And again, we should probably find out, well, we should certainly find out if it was anaphylaxis or whether it was just an adverse reaction. If it was anaphylaxis, we need to know about it and we need to comment on it. And we'd like to know whether you developed anaphylaxis with any of these vaccines. But the others do not contain polysorbate 80. None of them contain polyethylene glycol. If you've already had a COVID vaccine dose, either 1 dose or 2 doses, then the common questions we're asked are, I began to cough, developed throat tightness shortly after COVID vaccination. What should I do next? Well, we would ask you if there were any signs of an allergic reaction. Was there any swelling? Was there a rash? Were there hives? Did the cough settle either spontaneously or after taking an oral antihistamine? Or even after a single dose of adrenaline? We're finding that adrenaline has been given even when it's not an allergic reaction. And if that is the case, then you can have the second dose after pre-dosing with antihistamine, and you may need to continue the antihistamine for up to 3 days or longer if required. You can even have the same COVID vaccine. So we're not saying that this is a contraindication to even the same COVID vaccine. If, however, there were objective signs of an allergic reaction, swelling or rash, and the cough was diagnosed as anaphylaxis, then you need to be referred for further investigation. So instead of a cough, if you developed, instead of a cough and throat tightness, you developed shortness of breath after the COVID vaccine, then exactly the same applies. So if there were no other signs of an allergic reaction, you can have the same vaccine again, pre-dose with antihistamine. But if there were objective signs of an allergic reaction, then you need to have further investigation. I developed a large area of swelling and itching at the site of the COVID vaccine. It took a week to resolve. Can I have allergy testing or receive my next vaccination in hospital? So large local reactions with delayed swelling and redness and itching are rare to these COVID vaccines. They're more common, however, to the Moderna vaccine. It seems to be slightly more potent, more likely to cause a localized reaction. And these local areas of redness and itching can last for more than a week. So just be aware of that. It doesn't mean you're allergic. It simply is an indication that your immune system has been activated, and it may actually be a good sign to show that you're responding well to the vaccine. But the treatment is symptomatic: antihistamine for itch, for example, cetirizine, paracetamol and ice packs for discomfort. And you can certainly have the second dose of the same vaccine, or if you prefer a different vaccine, without allergy testing. And I would suggest having an antihistamine beforehand. I developed tingling of my mouth, tongue, and skin after COVID vaccination. About an hour later, I developed mild swelling of the lip, which settled with an antihistamine. What should I do next? Well, again, I would say this is not a contraindication to further doses. You're unlikely to have similar symptoms again. There's no truth in people, when people say to you the next reaction is going to be more severe, no, that's not the case. What we find with COVID vaccines is that if you had these sorts of symptoms with the first COVID vaccine dose, then symptoms with the next dose are more often than not less severe. But I would certainly consider pre-dosing with cetirizine, 20 milligrams, 1 hour before your next vaccine dose. You may need to be observed for a little bit longer than 15 minutes. And if it occurred about an hour later, you might need to hang around for up to 60 minutes after vaccination. But you can have any of the COVID vaccines, including the one that caused the symptoms in the first place. I developed urticaria and angioedema the day after COVID vaccination. It has lasted for 2 weeks. Can I be tested or have my next vaccine in hospital? So again, delayed reactions to the COVID vaccines are not due to allergy. They are due to the immunogenic effect of vaccination, and allergy testing does not identify whether you're going to have the same reaction again. An immunogenic reaction to a vaccine is desirable. It's a good sign. It shows that your immune system has recognized the vaccine, and it probably indicates that you're going to get reasonable protection against COVID. So it's not a bad sign. And I think the worst thing is if you don't get any symptoms. And so when I had my vaccine, for example, I was slightly worried because I had hardly any symptoms at all afterwards. So you may develop a similar reaction after the next dose, remember that. And so again, consider pre-dosing with cetirizine, 2 tablets, 1 hour before vaccination. And if the urticaria, the hives, the swelling lasted for 2 weeks, you can continue with cetirizine, 10 milligrams twice a day for up to 2 weeks afterwards, but you can have any of the current COVID vaccines. We're often asked about other allergies. So at the start of the vaccination campaign, there was some misinformation about people who had underlying allergies, and that caused a lot of anxiety and concern. And so some people ended up receiving 2 doses of the AZ vaccine unnecessarily. But now we know that there's no contraindication to any of the other COVID vaccines. So a typical history is that I'm allergic to wasp or bee stings. Even if I have anaphylaxis to bee and wasp stings, can I have my COVID vaccination in hospital? There's no need to. It can be given in the community. You can have any of the COVID vaccines, and allergy to wasp and bee stings is not a risk factor for anaphylaxis to any of the COVID vaccines. I have allergic rhinitis, asthma, eczema, and food allergies, or one of those things. Is the AstraZeneca vaccine the best one to have? Well, the answer is you can have any of the COVID vaccines. The AstraZeneca vaccine is not any less likely to cause allergic reactions than any of the others. So you can have any of them. Now, a rare question that we're asked is that I'm allergic to alcohol. Can I have the COVID vaccine? Well, allergy to alcohol is extremely rare. It's almost unheard of. True allergy to alcohol is extremely unheard of. You can get adverse reactions to alcohol, and it's usually not to the alcohol itself. The Pfizer and Moderna vaccines do not contain alcohol. The Oxford AstraZeneca vaccine contains a tiny amount of alcohol as excipient. And I mean, unless there's significant anxiety, then I would say you can have any of the COVID vaccines. But if you're really concerned about the tiny amount of alcohol in the AZ vaccine, you can have the Pfizer and Moderna ones. So those are my slides, and I'm happy to take any questions that have arisen from my slides or any other questions that anybody listening in may have. And I don't know whether we've got a list of questions.
Thank you, Shaib. That was really quite detailed and very interesting. And I really hope it's reassuring as well to our staff members that might have concerns with regards to allergic reactions. We've heard quite clearly that anaphylaxis after general vaccination is rare, and it's even more rare when it comes to the COVID vaccines. Before I start, maybe I'll ask Giles. Giles is Associate Director with Occupational Health Services. Giles, do you have any experiences you would like to talk to us about, particularly as it relates to people having vaccine in your center? Have you had any issues, major issues?
We've had one individual whose reaction was did require some intervention, some treatment, but still under investigation as to what the root cause of that was. But what I will say, Sani, is that I've led vaccination campaigns here now for a number of years, and we must have done 100,000 plus by now, including we've done nearly 60,000 COVID vaccinations over the last 13 months. So the events have been incredibly rare, even mild ones, in our experience locally. I was saying just before we started to shrug that I have a personal history of anaphylaxis, but not to vaccines, and not to COVID vaccine. But you do have that underlying anxiety whenever you have something new. Of course you do, but actually reassured by Shreb's guidance and my colleagues, and you kind of keep that in check, I think, a bit. But I echo Shreb's comments earlier. The evidence for us locally suggests that this has been a very safe and tolerated vaccine.
Excellent. And Shreb, you've talked about the sort of symptoms, the fact that most local reactions, especially the delayed reactions, are not really true allergy per se, that staff should be concerned about. But are there any specific features that staff should look out for, or that could be a sign that they could have anaphylaxis to any of these vaccines that you would?
So, I mean, again, I would just reiterate what Giles has just said. We've hardly ever seen proper allergic reactions to these vaccines. It's incredibly rare. And I sit on an international committee where we discuss allergic reactions in the US and Europe. And and between us, we have seen almost no proper allergic reactions. So the typical symptoms that people tend to get, which they think are allergic, or a metallic taste in their mouth, an irritation in their throat, a coughing, numbness of the lips, perhaps slight swelling of the lips, a dryness of the mouth. A lot of these are actually related to anxiety rather than to a true allergic reaction, and they're very common. And at the start of the vaccination campaign, a lot of these people got adrenaline, and people were really worried that you were going to get allergic reactions. And part of that was because no previous vaccine had contained polyethylene glycol, but we now are actually pretty confident that this is an incredibly safe vaccine. You know, these are, you know, the COVID vaccines are not likely to cause allergic reactions. If you were to get anaphylaxis, and I must say I'm not terribly convinced I've seen a proper one yet, you would literally get very rapid onset rash and visible swelling, not a sensation of swelling, but visible swelling. Your blood pressure would drop and you wouldn't be able to stand up. And those are the sort of symptoms I would expect to see, but we haven't really seen those symptoms.
And it appears the role of pre-dosing of antihistamines is really quite clear in this situation. Would you advise staff members that have a history of urticaria or rashes, etc., to take some of the antihistamines before, particularly cetirizine, before they get their vaccines, especially those that might continue to have anxiety or concerns about?
Well, what we found is that this has been a very effective strategy. And remember that the vaccines, and any vaccine, stimulates your immune system. It replicates a viral infection, and viral infections can trigger urticaria, they can trigger swelling. So if you have a history of anything similar to that, then I would certainly recommend taking cetirizine beforehand. And cetirizine works quickly. Take 2 tablets an hour before vaccination. You don't even have to necessarily tell your doctor you're going to do it. You can buy them over the counter. If there's any level of anxiety with previous allergic reactions, buy them over the counter, keep them with you, take a couple of tablets before you have your vaccine.
Thank you, Shaib. And then finally, how do people access, if they do need to access allergy services? I know you've said it's there's practically very little indication for allergy testing specifically to the COVID vaccine, but in a situation where it looks like they might require it, how do they access these services?
Well, I really hope that anybody with a history of allergy and they're concerned about their previous allergic reactions, I'm sure we can find a way of vaccinating them. And we've got people with severe allergic reactions to polyethylene glycol, and we found a way of vaccinating them. So anybody with a history of allergic reactions, we can find a way of vaccinating you against COVID to keep you safe. If you want to discuss it, I suggest contacting occupational health, and we can liaise with occupational health to determine whether any further investigation is required, or give advice. We can give individual advice for individual cases, some of which we may need to see, some of which we will not need to see.
Thank you, Shaib. That's really very clear. And thank you, Giles, as well for joining us. We don't have any questions online. Tony, I believe we will be we'll make this webinar available on Connect. And Shaib, if you're happy, we can also share the questions and answers you've already presented on Connect, so that staff can have access to them at their own time. But we've come to the end of this webinar. Thank you so much for your time, and hopefully we have allayed people's anxieties as it relates to the COVID vaccine, and hope that people will go ahead and get their jab. Thank you very much.